Good evening, everyone. Welcome to Occupational Therapy Feud. I'm your host, Maeve Denning. Question 1. This person is considered the father of occupational therapy. He was a psychiatrist who implemented the moral treatment program in the Shepherd Asylum where he worked in Maryland. He published Occupational Therapy, a manual for nurses, which describes simple tasks that nurses can do with their patients. He served as a treasurer and president for the National Society for the Promotion of Occupational Therapy. Who is he? Anybody else? Yes?
The correct answer is, who is Dr. William Dutton?
Correct. Who were the key players during 1920 and 1939? Yes, Shakir.
It's what we now call American Occupational Therapy Association.
That answer is correct. This lady is considered the mother of occupational therapy, and she originally was a social worker, but went to training courses in curative occupations at Chicago School of Civics and Philanthropy, which was associated with the Hull House and Jane Addams. She developed the practice of habit training and lectured at the Chicago School of Civics and Philanthropy to choose who were chronologically employed. She was also developed the first OT program, known as the Henry R. Ravel School of Occupations. Her home was the first unofficial meeting place of the NSPOT, and she held office within the organization. AOTA created an award given to one OT each year that makes exceptional contributions to the profession in this person's name. Who is she? Yes, Andrew.
The correct answer is, who is Eleanor Clark Slagle?
Correct. Who were the key players during 1920 and 1939? Yes, Shakir.
Is it Eleanor Clark Slagle, Thomas Kittner, William Denton, and Adolph Meyer?
Yes, that answer is correct. What organization expanded during the 1920s and 1930s? Yes, Shakir.
It's what we now call American Occupational Therapy Association.
That answer is correct. In what year did the American Occupational Therapy Association create the Eleanor Clark Slagle Lectureship and Award of Merit? Yes, Kristen.
1953 was the year it was created.
That answer is correct. Was the American Occupational Therapy Foundation established, and what was the purpose of establishing it? Molly.
It was established in 1975. During this time period, the practice of occupational therapy was shifting to a more science-based approach due to the changes and growth of healthcare costs and a search for professional identity. The purpose of the foundation was to research and progress the science of occupational therapy and promote the study of the profession to the public.
That is correct. Who was the president of AOTA during its reorganization in 1964? Who reinforced the importance of the expansion of the scientist aspects of occupational therapy? Molly.
Wilma West.
That answer is correct. Name some of the characters of the 80s and 90s that were influential in the development of OT, and what was their contribution? Kim.
Florence Clark. Her efforts gained recognition to occupational therapy as a science. Also, Gary Kalhoffner. He was the inventor for the HOMO, and we also have Elizabeth Ixeria, and she was the one who created the first PhD program for occupational sites.
That is correct. In 1980, what theory was made popular and by whom? Kim.
Clinical reasoning. Joan Rogers brought the theory of clinical reasoning to the forefront, so much so that she introduced it as the Ellen Clark Slagle Lecture for 1983.
That answer is correct. It looks like we have a 5-way tie. We'll go into a sudden death match where the first 2 questions will be worth 200 points and the last one will be worth 5. In the year 2000 at the Slagle Lecture, Margot Holmes spoke about the importance of evidence-based practice. What is evidence-based practice? Molly.
Evidence-based practice is integrating individual clinical expertise with the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of an individual patient.
That is correct. In 2014, the 3rd edition of the Occupational Therapy Practice Framework, Domain and Process was published. What does the OTPF3 find occupational therapists responsible for? Kristen.
OTs are responsible for all aspects of OT services, delivery and accountability for the safety and effectiveness of the OT services, delivery and process.
That is correct. 500 points. When is the 100th year anniversary of occupational therapy? Andrew.
The centennial is in 2017.
That answer is correct. Congratulations, Andrew. You have won a trip to the 2016 AOTA convention in Chicago. Woo!